Milwaukee County is nearing 100 deaths from coronavirus this morning, as at least 154 people have died in Wisconsin. Milwaukee County still has the most positive cases, with about half. That's a little more than 1,700. More than 3,400 people have tested positive across the state. At least 36,000 tests have come back negative for coronavirus. The developments in the coronavirus pandemic can be hard to keep up with. We learn new details about the disease every day. And this morning, Dr. Christopher Davis from the Medical College of Wisconsin's Kern Institute joins us live to answer some of your questions. We are taking these questions live on our CBS 58 Facebook live stream. Here's what happens. You ask your questions there, and we will relay them to Dr. Davis. So, Dr. Davis, we just saw these new numbers, which come out every day. They're updated multiple times a day in some counties. What are we supposed to make of them as the general public, and what do you make of them as a health professional as they change every day?
Right. I think number one to keep in mind is that we're lucky in Milwaukee County to have such an accurate dashboard to look at to give us a sense of where things are going. The other thing to keep in mind is that right now we're expected to be at the peak of the pandemic in Milwaukee, and the numbers, they're not skyrocketing. I cannot yet say that they've flattened out. We haven't necessarily made sure that we've flattened the curve, but there is some promising information in the way that the stats and the curves look like right now.
The general public sees that, these promising stats. Should we get excited about it? Should we change anything we're doing, or does it mean that we should just keep doing what we're doing?
Keep doing what we're doing. The most consistent things are the messages we've had all along, which is to stay home as much as possible, social distance, stay 6 feet away from others, and pay attention to hand hygiene. We'll get to the face masks and face coverings probably a little bit later, but it's the most important thing to remember about those is they're just an extra thing that may or may not, according to the science, make much of a difference, but they surely don't hurt. And probably what they do best is protect, for instance, me giving the infection to somebody else. It protects others from getting an infection from you, whether or not you know you have the disease.
Well, let's jump right into some of our viewer questions right now. Mary's on our Facebook page. She's asked a couple questions about high-risk people. She wants to know if children with asthma are considered high risk.
They may be a little bit higher risk than some, but there's not really any indication that children are at high risk for getting the disease or having very bad symptoms of the disease. If you look at the number of children admitted to Children's Hospital, it's actually very few, fortunately.
Mary also wanted to know if those that are high risk or the elderly will ever be advised that it is okay to go outside. Will that happen before a vaccine comes out?
Yeah, that's a really hard question. Right now, we don't even know when people are going to be advised to relax some of the restrictions. And it's going to be, I think, a long time before the higher risk population, elderly and those with comorbidities, are going to be recommended to relax. And the vaccine is going to be a long ways away too. So we may just have to kind of stay the course in terms of our high risk population for a while.
Dr. Davis joining us here from the Medical College of Wisconsin's Kern Institute. We're taking your questions live here on our Facebook live stream. Go to our Facebook live stream, the CBS 58 Facebook page, ask your questions, and we will relay them to Dr. Davis. Also wanted to ask about the numbers that we've been seeing, more about the negative cases. 36,000, I think, was the last number, 36,000 negative cases. What do you make of those? Is that good news? Are those people in the clear now?
It's good news. That kind of gives us a reminder of what the numbers really mean. It's, for one, it's just a sampling of the general overall population. And so it's hard to interpret what that means in the context of everybody in Wisconsin or in Milwaukee. The other thing is the test, it does have some false negatives, but probably not that many. So I think it's consistent with the fact that we're doing a relatively decent job with the restrictions that we're imposing and what people are doing.
These 36,000 negative cases, does that mean that some of them, all of them, are immune to the disease, or they just haven't caught it yet?
They haven't caught it yet, and they still are at risk.
Are some people immune? Are some people just going to be safe from this?
That's also another question that we haven't entirely figured out. Some of the immunity revolves around what the overall burden of virus you might have gotten in the beginning was, and how robust your immune response was to that infection. If we go back to other similar virus infections in the last couple of decades, we see that maybe some aren't conferred lifelong immunity. So it's a little hard to say. We just can't really answer that question 100% right now.
Understandable, because this is so new. Also, we get a lot of questions all the time about people recovered. Why aren't we reporting more about people who are recovered? Freighter Hospital just started announcing that they're going to start announcing what they can about recovery. I think they announced yesterday that they've had 114 patients recovered from that hospital. Why are those numbers so just hard to trace right now?
Well, it takes time for people to recover, for one. A lot of times when these people get sick and end up in the ICUs, it takes days to weeks, if not a month or more, to recover and get out of the hospital. That target, those data are just now coming through, so we can reflect on those in terms of the overall burden of disease and the mortalities.
Another question here from our Facebook comments. Bud asks, if you wear masks and gloves, how often should they be changed?
It kind of depends on the mask and what you're doing. Right now, the recommendation isn't necessarily to wear gloves out in the community. The recommendation is hand hygiene, so frequent hand washing with soap and water for 20 seconds, or use of alcohol-based hand wash with 60% alcohol or higher. And then the masks also another thing that we don't have a great sense of because it's not something that we've investigated very well either in our country or anywhere else. But the general recommendation would be, if you're going to go out, if you have to go out and you have a mask, you put that on, or some kind of face covering, and you just leave it there in place and don't touch it as much as possible. And then when you're done doing whatever you had to do out in the community and you're back at home, then you cautiously take it off without touching the front of the mask. And then when you're done doing that, you wash your hands again.
Dr. Davis joining us here for a full hour from the Medical College of Wisconsin. We just saw a little bit about the masks that Medical College of Wisconsin are donating, making a huge donation. We're going to talk about that in just a moment and continue to take your questions on our CBS 58 Facebook live stream. We've got a lot of great questions on there. We're going to continue asking Dr. Davis. Right now we're going to go to a quick commercial break, and we'll be back in just a moment. We'll be busting up some more common myths about coronavirus and giving you the information you need to know to keep your family safe. Stay with us. Welcome back to the CBS 58 Morning News at 7. We are continuing to get answers to your questions about coronavirus. So many people have so many questions. And joining me once again here, Dr. Christopher Davis from the Medical College of Wisconsin's Kern Institute. Dr. Davis, again, we are taking your questions. We are taking your questions on CBS 58's Facebook page. Ask your questions on our live stream in the comments area, and then we will relay them to Dr. Davis and get the answers to all of your questions. In this section, we're going to talk about some of the myths, some facts over fear. And Dr. Davis, we're going to run through a couple of these and tell us whether or not they are correct based on what the science is so far at this point. First of all, the age myth. At first, we thought that only people 65 or older could possibly even get this or get it seriously. But we're seeing that a lot of younger people, a lot of them with previous conditions, are still getting them. Some people, in their 30s, 40s, 50s too.
Yeah, I'll tell you along those lines, what was the most sort of eye-opening, I think, for healthcare workers is that some of the early deaths out on the West Coast were actually healthy, emergency room physicians or people without any comorbid conditions that were in their 30s and 40s. And that certainly has still been the case, that there are individuals here and there that are younger than 65 that might actually be entirely healthy for as far as they know, that acquire the infection and get so sick that they actually pass away. Fortunately, it's sparing children by and large, but nobody really should feel safe from the disease if they're otherwise young and healthy. Everybody needs to still maintain their proper protective measures because anybody's at risk of dying.
What about the effects of the weather on COVID-19? Once it gets warm here, is that going to make a difference?
Yeah, we don't really know yet how that's going to impact the virus. Traditionally, these viruses do kind of wane a little bit in summer months, but that yet with the current coronavirus is to be seen.
Anything about, we've actually seen a lot of posts about 5G. Did 5G technology cause the coronavirus?
No, that's a complete myth. That one we can just say that doesn't have anything to do with one another.
All right, so you can get your questions answered right here on our CBS 58 Facebook page, and it sounds like you have a little visitor there, Dr. Davis, as we all are working at home.
Yeah, I'm trying to do my due diligence and stay home. We'll try to deal with the baby here in a second.
Hey, that's a reality for all of us, Dr. Davis. Completely understand that. Again, we are taking your questions on our Facebook page. Go to CBS 58's Facebook page. You can ask your questions in the live stream. We're going to jump back to another commercial break in just a moment. But when you see the red screen pop up on that live stream, we are still staying with Dr. Davis for the entire hour here. We're with him until 8 o'clock. So time right now is 7:11. Your questions continue here as we stay live on the CBS 58 Morning News at 7 on WMLW The M. Welcome back this morning. We're having a special hour-long edition here of the CBS 58 Morning News at 7 on WMLW The M, where we address myths, misconceptions, and your questions about coronavirus. We go back to Dr. Christopher Davis from the Medical College of Wisconsin's Kern Institute, and we just got an email question into us. Are people with chronic inflammation or allergies more likely to contract COVID-19, Doctor?
Chronic inflammation and allergies, I guess it mostly depends on if you're on some immunosuppression or the inflammatory condition you might have. That would predispose you probably to infection. The allergies, I can't say there would be a direct link between the two, but that's also a little hard to tell.
It would also, do those symptoms kind of are similar in some ways? That you think you might be going into the doctor if you have a bad allergic reaction, if hay fever is real bad or anything?
Certainly if your allergies manifest themselves with similar symptoms as the coronavirus, like cough, sore throat, those sort of things can mimic the disease early on. So I would say if those people have those kind of conditions, to be a little bit more wary that it may not just be their typical allergies, that they may be coming down with the infection.
Then you would go into the doctor, possibly get a test. We'll talk more about testing in just a moment. Let's talk about some more of the myths surrounding this right now. Does drinking alcohol make the reaction to coronavirus any worse or better?
I would say it probably doesn't make it any better. There's actually been some people reported in the world that have died by trying to drink enough alcohol, quote unquote, to kill the infection. People that drink alcohol or are chronic alcoholics, they actually have a worse immune system and likely comorbidities that might actually predispose them to having the infection or having the infection cause a bad disease process. So alcohol is not the way to go regardless. Another myth, can mosquitoes transmit this between humans? There's been no indication of that. Not read that anywhere. Probably not.
How about an ultraviolet disinfection lamp? Can that kill coronavirus as opposed to scrubbing down your counters or something?
It seems to be a possible mechanism, although the duration that the UV light has to be exposed to the virus is still a little bit up in the air for debate. We looked into this in the hospital setting for disinfecting the N95 masks to be able to reuse them. And it seems to be effective, but again, that's in a hospital setting and not just a simple UV light at home. I think the rest of the chemicals and wipes are the way to go when you're at home.
And finally, for this myth section here, are antibiotics effective in preventing or treating coronavirus?
Nope. So it's always important to keep in mind that antibiotics are designed for bacterial infections. And as the coronavirus, it says in its name, is a virus, antibiotics are not effective. And right now, there's no antiviral, there's no antivirus medication yet known or that's been developed to help treat the disease.
Dr. Davis breaking down some myths right now. We have a lot of questions, great questions coming in on our Facebook page. Carol has a great question, Laura as well, a few from Kelly and Mary. We'll get to all those coming up in our next half hour. If you have a question, please go to the CBS 58 Facebook page, jump on our live stream, ask the questions here for Dr. Davis from the Medical College of Wisconsin Kern Institute. We will ask them to him coming up at 7:30. But before we go to the break, we check in with meteorologist Sam Kuffel for a quick check of the forecast. Good morning. Thanks for joining us. It is Tuesday, April 14th. I'm Mike Kirkhoff. Pauline Lee joining us from home this morning. How's it going, Pauline?
It's going great. I pulled out my quiche. Man, I did a good job. Mini quiche, 3 ways, guys. It's great.
Oh, nice. Enjoy it. Pauline Lee is on our live stream right now on CBS 58's Facebook page. We're going to continue our interview with Dr. Christopher Davis from the Medical College of Wisconsin Kern Institute. He is answering your questions about coronavirus. Any question you have, ask them on our CBS 58 Facebook page. Our coronavirus coverage continues. Milwaukee County is nearing 100 deaths from coronavirus this morning, as at least 154 people have died in Wisconsin. Milwaukee County still has the most positive cases, with about half. That's a little more than 1,700. More than 3,400 people have tested positive across the state. At least 36,000 tests have come back negative for coronavirus. If you're just joining us, we've been speaking to Dr. Christopher Davis from the Medical College of Wisconsin's Kern Institute. Dr. Davis has been answering your questions on CBS 58's Facebook live stream. We've got a lot of them coming in. Mary asked several questions, Doctor, basically related to how our hospitals doing right now. Are they overrun? Do they have enough equipment? How are things going?
Yeah, so I work at Froedtert in the Medical College of Wisconsin, so I can only speak mainly for Froedtert Hospital, but I know that we're not overrun. Our system is fully up and functional, except for canceling elective surgeries and whatnot. But anything that's urgent, that anybody has any urgent medical problems, whether it's the virus or not, we're still open for business and taking care of everybody very effectively. And I think, honestly, at least again speaking for Froedtert Hospital, we've done a very good job of staying ahead and being prepared for right now what's supposed to be the peak of the virus in Milwaukee, and we're handling it. There's been some strain, but we're handling it.
Does this look like peak? Is this what peak is going to look like? Do you think that we are at the peak and it's going to start going down soon?
Let's hope so. If you look at, again, the dashboard for Milwaukee County, you can maybe start to see some flattening of the curve at the top of that peak, but I wouldn't say we're out of the woods yet.
Carol asked on Facebook, can you catch this just from playing outside? Can you catch us outside?
Not really. Again, if you have to be really within 6 feet. Some scientists may say, a little bit further than that if you're in an enclosed environment. But if you're outside, away from people, nobody's coughing on you directly or touching you, that you shouldn't really be able to catch this disease.
I mean, even if you're just passing someone on a jogging path or bike path going the opposite direction?
Yeah, it's a low risk. That's a low risk situation. Again, we should all still try to stay 6 feet or more apart from one another, even if it's the parks, or out and about. But yeah, those are lower risk situations, but you can't say that's 100% no risk. So we all need to still stay home and do what we're doing.
So one of the things Medical College of Wisconsin has done is making roughly 80,000 face coverings to give out to some of Milwaukee's most underserved communities. Can you tell us a little bit about that initiative?
Yeah, the most important thing is to update the numbers with what we're doing. The long story short is I was put in contact with a company called Rebel Converting, Mike and Thaddeus Kreshik, who had come up with a plan to make masks out of the material that they make in their company, to distribute to the underserved population of Milwaukee. And initially, they wanted to become serve part of the 10 million mask project that was a nationwide objective, and they had initially wanted to donate 1 million masks, but they've now bumped that up to 2 million. Wow. And what we're trying to do at the Medical College of Wisconsin is help spearhead that effort, number one, with our students and our staff making masks, and then number two, distributing them to exactly where in the city that we feel on a public health level and in the community level that they're needed the most.
That is a big need right now. Also a need that a lot of people, everyone's saying really, is a need for a vaccine. That's probably how we're going to get out of this, right? What's the progress on that?
Need for, I'm sorry?
A vaccine.
Oh, a vaccine. Yeah, I mean, that's way down the road. It takes time to develop these things, to test them, to make sure that they work well. So, it's going to be a long time before we even figure out what that means.
Is that the only way to kill this disease? I mean, how does this end?
Yeah, and that's the other thing too, is that eventually we, as a population, another thing that's known is something called herd immunity, where there's enough people that have had the disease, whether hopefully mild or asymptomatic even, or severe, but there's enough people that have contracted the disease and and formed an immune response that disease, month after month and year after year can no longer spread amongst the population. So
we have a rather specific question here from a man named Mark. He wants to know about people that have passed away from COVID-19. Are they still contagious after they've passed away? Is it safe to attend funerals or an open casket or things like that?
That's a question I can't honestly answer. The short answer is yes. They would be infectious for a period of time. How long that might be and what precautions need to be taken, I don't know. That's a good question for a coroner or somebody that works in the mortuary.
Okay, coming up next, we're going to talk about testing and how we're being tested, blood tests, and that kind of thing. So stay with us. If you have any more questions, please join us on CBS 58's Facebook page. Our live stream continues. Ask your question. We will relay it directly to Dr. Davis and do our best to get you an answer. Thanks so much for joining us. We'll be right back. If you're just joining us, we've been talking with Dr. Christopher Davis from the Medical College of Wisconsin's Kern Institute, answering your questions about coronavirus. Keep them coming on our Facebook live stream, and we will get to them. We want to talk about ventilators right now. That's been something that we've heard a lot of talk about, a lack of ventilators. How do they work? How are they used to treat this?
Yeah, the main thing is if somebody gets so sick that they can't have adequate gas exchange from their lungs to their blood, they won't get enough oxygen into their system or get rid of enough carbon dioxide out of their system. And in that case, if their lungs are so heavily affected by the infection, they need to be put on a ventilator to sustain their lives. And we do that for any number of conditions. However, this is an infectious process that we know that people are at risk of primarily respiratory failure from. And so sometimes a ventilator is one of the last lines of defense against mortality. Are you able to reuse those or no? Is that why there's a shortage? No, we can. They have to be properly sterilized and cleaned. And all the tubing is thrown away and all that kind of stuff. Okay. But it's mainly the number of patients that we were fearful would overwhelm the amount of ventilators available. Sharon asks on Facebook, if you unknowingly come into contact with someone who may have the virus or is carrying, how long would it be before you would show symptoms, and when would you be considered past the contagious time frame to others? Sure. It could take up to a week or even longer. We don't still know 100% for the COVID-19 disease, but certainly it could take several days, a week or more before you start developing symptoms of infection, which you might not actually do. Some people just remain asymptomatic and not know that they even contracted the virus. We've got about a minute left here in this segment. I've got a few people that have asked, including Marty, about blood tests to see if you had the virus. How would blood tests work compared to the swab test? And talk a little bit about testing for us. Yep, so the swab test, that generally is a swab that goes to the back of the throat, and it is designed to detect the actual virus molecules that are there. And that is pretty rapid turnaround and tells you whether or not at that moment in time you have virus in your system. The blood tests are designed to test antibodies, and so what they do is they tell you further down the line if you ever did have the disease. And that's going to be an important thing epidemiologically once we start testing the population for the antibodies to see how many really did get infected with this during the pandemic. All right, stay with us, Dr. Davis, and viewers at home and on Facebook Live. Make sure you keep sending your questions in, and Dr. Davis will have more answers for you coming up. We'll be right back. Welcome back to a special edition of the CBS 58 Morning News on WMLW The M. For the entire hour, we've been talking to Dr. Christopher Davis from the Medical College of Wisconsin's Kern Institute, answering all of your coronavirus questions. And Dr. Davis, one of the things that we have seen is a disparity, a racial disparity in who is catching COVID-19 and who is suffering seriously from it. Why, especially here in Milwaukee, why is the African American community being hit so hard? Yeah, I think that's probably one of the most important questions that we can be talking about today. And really the answer to your question is that it's the decades of divism that's existed between parts of our population. Unfortunately, the African American population, doesn't have insurance. Sometimes they're poor. They're born into just a circumstance where they don't have as much of a chance to stay healthy for as long as other people in the population do. And so they have more comorbidities, lack of resources to go to the doctor. A lot of people actually have to continue working because they live in this and work in the service industry. So there's just any number of things that has unfortunately played into their lives and their risk for contracting the infection and even dying from this. And as we look at the dashboard for Milwaukee County, it's not any different than Chicago or St. Louis or some other major cities where more than half of the deaths are from African Americans, which is it's a travesty.
And something that we'll definitely have to keep continuing looking at, keep raising that awareness and seeing exactly what happened as we get past this. Let's go to more questions on our Facebook stream. Both Greg and Laura have asked questions about food. One, does it live on groceries? And two, what about ordering takeout? Is there any risk there?
Small risks. I think the service industry and the food industry is doing what they can to keep the virus from being on the food or on the bags and things that we handle the food with. There's no perfect answer to that, other than when you do go to the grocery store or come in contact with somebody at the curbside pickup, that everybody's wearing their masks, and when you go home to wash your hands or use the hand sanitizer as much as is recommended as possible. There's no way to completely take that risk out of the equation, though.
We're getting a lot of questions from almost everyone on here. When will this end? When can the economy open back up? When can we go back to work, back to school? I'm sure you can't give us an exact date on that, but maybe you can describe what life would look like at that point, what doctors would need to see, what scientists would need to see. And we'll talk about that coming up after this break. And thank you for sticking with us, Doctor. Thank you for sticking with us at home and also on our Facebook live stream. We'll answer that question when we come back. Well, welcome back. We've been talking to Dr. Christopher Davis this entire hour to answer your questions about coronavirus. And Doctor, as we wrap this up here, how does this end? What do scientists and doctors say the world has to look like, a country, the state has to look like before we can start going back to normal?
Yeah, there's a couple of important things to consider. One is that we for sure have to see a downward trend in the amount of new cases. Another key component to this is that we have to have enough testing capability so that we can detect recurrences of the disease in any given community, and it has to be a rapid a number of tests that we can administer right away so that we can get on top of those. And another important concept is making sure that we in the hospital systems do have enough of the materials to take care of sick patients, so that when we do relax the restrictions, if there's any further patients coming our way, that we're completely prepared and ready to take care of them too.
Dr. Davis, we appreciate your time this morning. We know as many healthcare professionals you're incredibly busy at this time. Also, thank you to our Facebook fans, the people watching on our live stream, for answering some great questions. Sorry we could not get to all of them. I'll try to ask Dr. Davis a bit later and try to get some of those answers. We'll respond within the Facebook live stream to some of the answers that we can get. All right, welcome back. We are having an extra overtime here with Dr. Davis, answering some of the questions we could get to on our live Facebook simulcast on WMLW. So, Dr. Davis, I'm just going to run through a few of these questions that we have right here, if you don't mind.
Yeah, that'd be fine.
One question was, if you have it and have recovered, can you catch it again?
It's maybe a little bit of a two-part question that depends on your original immune response to that infection. Most of the time with viral infections or infections in general like that, you do have some immunity and hopefully will be protected from reinfection. But with this particular coronavirus, it's still not entirely sure that you'll be afforded lifelong protection.
What about pets? How are pets involved in this? Laura wants to know if pets can carry the virus. If you have it, can you give it to your pet, and then can someone catch it from your pet?
Yeah, I'm not a veterinarian, and so I can't quite answer that question, although I do know some pets have been diagnosed.
Mm-hmm. Okay, if you have, can you have coronavirus but not have a fever, asked Lori?
You can, and that's been one of the biggest troubles with tracking this disease is that a lot of people, probably the majority of people, are actually asymptomatic and may not know that they have the infection. And that's the risk of us going out into society and coming in contact with others, that we may actually pass that on to somebody else unknowingly.
Greg asked, what is the specific risk for people with diabetes?
I can't say what the specific risk would be. It might matter how well your diabetes is controlled and your age as well. But there would for most patients be a little bit of a higher risk because diabetes, generally speaking, does have some diminished immune response to infections.
Understand if you can't answer this one from Michelle, but she wants to know if there's been an increase in suicides or depression or anxiety because of this?
I don't know about suicides, but it is a concern across the population, anxiety and depression. It's going to be interesting when we look at this whole stay-at-home thing that we've done, how it has impacted the society's mental health. Mm-hmm. Certainly amongst healthcare providers, we're a little bit on edge, so we know that's true.
I think we've gone through all of them, but one thing we did not talk about, perhaps this could have gone in the myths section, but people are constantly asking and saying this is no worse than the flu. Why have we shut down everything? Is it worse than the flu? In what way? And should we maybe have a bigger reaction to the flu?
Good questions. I would say that number one, it is worse than the flu. We know that the mortality rate from the coronavirus, from COVID-19, is greater than the regular influenza. And that being said, I think a lot of people are across our society not quite in tune with how many people actually die every year from the typical flu, tens of thousands, and that's why it's so important to pursue getting the vaccine every year, for number one, protection for oneself, but also the herd immunity, mm-hmm. so that tens of thousands of people don't have to necessarily die. And it's the same thing in my line of work. A lot of what I do, I'm a trauma surgeon, and people don't realize that the most common cause of death between the age of 1 and 45 is injury. So if there's simple preventative measures that we can do better, we can certainly do better as a society of keeping people long and healthy lives.
And the general advice here for coronavirus, aside from shutting down the economy, would also work for flu season. Wash your hands, don't go to work if you're sick, et cetera, et cetera.
Exactly right. It's very basic things that we should probably just be more attentive to as a population. And maybe if there's going to be any silver lining, we're going to be more attentive to the plight of our neighbors and to simple things we can do to help spread disease.
All right, Dr. Davis, thank you once again for going through all of these questions that we had on our live stream and for joining us all morning. We know, again, it is a lot of time, but these are all important questions that a lot of people have.
Great. Again, thank you for having me.